Everyone to First Friday Breakfast. We're so happy to have all of you here today. My name is Laura Munoz Humphreys. I'm the Executive Director at the South Bay Family and East Lake YMCAs, and I'm going to start us off with an invocation. Gracious God, help us look to the past with gratitude and to the future with hope. Make each of us an instrument of your grace. Weave us into a community showing forth your power and tenderness. Bless us and our differences, and give us the courage to stand together. We call on you today to gather us in your love. Teach us that even if we can't do great things, we can at least do small things in a great way. May we always be sincere in our efforts to help others in need. Lead us to better know you and glorify you on each step of the journey of our lives. We remember the following words from Mother Teresa. The fruit of silence is prayer. The fruit of prayer is faith. The fruit of faith is love. The fruit of love is service. The fruit of service is peace. Let us now keep silence and breathe in the love of God. Amen. I'd like to welcome Lisa Cohen, the CEO of the Chula Vista Chamber of Commerce, who is going to lead us in a Pledge of Allegiance.
Good morning, everyone. It's my honor to have the Pledge Allegiance to our great country. Please stand and place your right hand over your heart. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Thank you so much, Lisa. And welcome to those of you who are joining us for the first time for First Friday Breakfast. The breakfast is a long-standing tradition in Chula Vista. Usually we meet on the first Friday of the month at the San Diego Country Club, but we are blessed that we have the technology to still convene, but are looking forward to the time when we can meet again in person. There are 4 partners who host First Friday. We are very excited to welcome Vice Chair County Supervisor Nora Vargas, the Mayor of Chula Vista, Mary Casillas Salas, the Chula Vista Chamber of Commerce, and the South Bay Family YMCA. Today we have a very special presentation from Supervisor Vargas, and I'm going to share a few words about her, although I know she doesn't need an introduction for many of you who are on this call. On November 3rd, 2020, Supervisor Nora Vargas was elected to the San Diego County Board of Supervisors, representing District 1. Supervisor Vargas was sworn in on January 4, 2020, and elected Vice Chairwoman of the board. Supervisor Vargas' priorities include mitigating the impacts of the pandemic and focusing on economic recovery while ensuring equality and inclusivity. Prior to her election to the San Diego County Board of Supervisors, Supervisor Vargas was an elected member and president of the Southwestern College Governing Board, the only public institution of higher education within San Diego's South County. Supervisor Vargas served on the board of Southwestern since her appointment in 2013 and was elected twice to the position. Supervisor Vargas also served as the Vice President of Community and Government Relations at Planned Parenthood of the Pacific Southwest, where she worked to increase access to safe, quality healthcare and education for women and families across California. In 2015, Governor Jerry Brown appointed her to serve on the 12-member California State Teachers Retirement System, making her the first Latina to be appointed in the board's history. In that capacity, Supervisor Vargas was charged with securing the financial future of California's educators, providing retirement, disability, and survivor benefits for California's educators and their families. CalSTRS is the largest educator-only pension fund in the world and the second largest pension fund in the United States. For the last 25 years, Supervisor Vargas has worked to drive positive change and serve her community through public service. She is committed to ensuring that marginalized voices are included in the public dialogue regarding important issues such as health access, energy, technology, consumer protection, the environment, civic engagement, pensions, and education. Supervisor Vargas is proud to serve the more than 630,000 residents of District 1. Thank you for being with us today, Supervisor Vargas, and welcome.
Good morning. Good morning, everyone. Thank you so much for this exciting morning. I wish I could be there with all of you in person. I want to thank you, Laura, for that introduction. I'm so proud to be here. I know that I've been actually coming to the First Friday Breakfast for a few years now, and it's one of my favorite events. Although it's a little bit early, but I get to see everyone, and I'm excited, and it's just an exciting time. And so I wanted to say that I'm really excited to build on the tradition that Supervisor Greg Cox started in partnership with Mayor Mary Salas, the YMCA, and the Chula Vista Chamber of Commerce. I know that one of the things that I really love and enjoyed about the First Friday Breakfast is that it provides a space where we can all come together to really highlight all the great work that has been going on in the community, discussing ongoing projects and highlighting each other. And although it's really focused on Chula Vista, the truth is that everyone who's here today really serves the South County community region. And so it's an honor to be here with all of you. Next slide. And although we can't be there in person, I'm glad that I get to be here with all you virtually, like I mentioned, and I want to use this opportunity to give you a glimpse into some of my priorities as a supervisor. And finally, I want to spend the majority of my time talking about, the global pandemic and the vaccines and the impact that it has had in South County and on our business community, and then open it up to Q&A as well. The next slide, please. So I wanted to start off a little bit. I know many of you know me, but I wanted to start off a little bit about me and my family story, because this is what really has shaped me and my values and what drives my work that I do in partnership with many of you. Next slide. My commitment to community really is rooted in family values and my love for this community. I've really dedicated my life to removing barriers for underserved communities through civic engagement, public policy, and community organizing. I was raised in this region. I think many of you know that I was born in Tijuana and raised in San Diego, and I went to local schools, right? I have been organizing in this community for years, and my passion really to serve has been driven by my desire to really improve people's lives. Next slide. I wanted to share that, I think I was raised here in South County, and I attended public schools. You can go ahead and keep doing this slide. So I just wanted to share some pictures with my mom and my dad so that and my siblings, because I think sometimes, we think of politicians and we think of these people who are supposed to be doing all these, that magically solve every problem. And I just want to remind everyone that, we are human as well. And it's important for people to share, the why, right? And so I was raised in South County. I attended South Bay Public Schools. I went to Montgomery High School, Southwestern College. I think I see some of the Southwestern College folks are here today. And I was really honored to serve as president of the governing board numerous times. This community is where I bought my home. This is where I began my journey for public service. And for more than 20 years, I really have dedicated my life to fighting for our communities. And, I had the honor of being an executive at Planned Parenthood, which is one of the largest reproductive health providers here in the region. I led really efforts to increase access to safe, quality healthcare and education for women and families across California. And as president of the Southwestern College Governing Board, and during my tenure there, I really fought for students to have access to affordable education and job training, from recent high school graduates to our veterans to our students and our dreamers. And, for 25 years, I've had a chance to break many barriers, and I've been the first in many spaces. And here I am today, very, very proud to be the first Latina, the first immigrant, and the first woman of color in this position. And I really don't take this responsibility lightly. I really, when I decided to run for office, I did that because I was witnessing that disparity gap that kept widening in our communities, right? It was children were going to sleep hungry. Our students and our teachers were sleeping in their cars. Rent was becoming to get too high, and our families, were going to emergency rooms instead of having access to their own doctors and affordable health care. And, these disparities for me became even more evident because my mother faced healthcare challenges. And when she did, she really didn't have a chance to receive the help that she needed. And that was really frustrating and heartbreaking for me and my sisters and my brother. And so my family. And And I think this is what really made me want to ensure that nobody else in our communities, particularly in District 1, ever felt that way. And I think that's what continuously fuels my work, right? I'm really excited that I've assembled a great team that comes from the community, that understands the power of advocacy, a team that comes from organizing, and a team that looks at everything from an equity lens. And so, next slide. I said to everyone, can you do the next slide, please? Thank you. So I say to folks, it's really amazing because I want to make sure I remind folks that now you have an organizer, an advocate on the Board of Supervisors, and it's a very different lens, right? I'm the first supervisor to have a background in public health care. And so it's very timely. And so in these past 5 weeks of my tenure, believe it or not, my team and I have spent a lot of time focused on mitigating COVID-19 and the pandemic and what it means. And really, well, my priority is ensuring that we get vaccines in every person's arm. I also am really proud of all the other policy work that we've done in a very short amount of time. And so some of the initiatives that I've championed since then is on my first week of the board, we proudly joined Chair Nathan Fletcher in introducing policies and resolutions where we were able to declare racism a public health care crisis. And more, and just as important was creating an equitable and COVID-19 response. And so both policies passed unanimously, believe it or not, on the Board of Supervisors, and I think it will have a direct impact in the county now, and because we're using an equity lens to really make significant investments in historically marginalized communities. The other thing is to really fulfill my promise of addressing the climate crisis in San Diego County. I think many of you understand that this has been plaguing our community for years. I was proud to join Supervisor Tara Lawson-Remer in proposing the establishment of a climate advisory committee and the establishment of a regional sustainability plan that will guide our county to a zero carbon future. And I'm proud to announce that next week on Tuesday, I will be introducing an environmental justice policy package that really establishes the framework to building healthier and stronger communities. My proposed environmental justice policy project really is something that I think many folks in our community have wanted. And so we'll be declaring the declaration of pollution at the Tijuana River Valley a public health care crisis. And that's important to me because, one of the things that has happened is that we talk a lot about the infrastructure and the needs in the Tijuana River Valley, but we sometimes forget to really elevate the healthcare impact that it has had in our region. And so looking at it from this lens, I think that we can really push the federal government and the state government for additional resources to once and for all really find solutions to address this issue that has been impacting our communities for decades. We are going to be creating the South County Environmental Justice Task Force that's going to be comprised of federal, state, and local representatives from agencies, environmental justice organizations, the binational community, our residents, and of course our amazing elected officials at the local level who have been at the forefront of this issue. Advancing healthcare equity by addressing food insecurity is going to be a piece of this. I think many of you know that green spaces tend to be a challenge in South County. I mean, now more than ever, this pandemic has demonstrated how difficult it is for many of our communities, right? And so really improving access to parks and green spaces is also a priority, as well as addressing the issue of our food deserts. One of the things that I'm most proud of this is the fact that Chair Fletcher and I introduced a board letter specifically to address health equity. This has been the catalyst for how we make our decisions as we're moving forward on the Board of Supervisors. And I'm really proud to share with you that as a result of our health equity lens, we now have 6 pods in South County because we know that we're the community that has been the most impacted by the COVID pandemic. Next slide, please. I wanted to share this slide because this map shows not only the location of all the county pods and super stations, but it demonstrates the different pods. And I hope that you can see it. I know it's a little bit small, but it has 7 vaccination including 1 super station here in Chula Vista. And that's a partnership, I think all of you know, with Sharp and the city of Chula Vista, and the mayor and I have worked really close to make sure that that has happened. In San Isidro, we were just able to open up another pod last week where we're administering about 100 vaccines per day with the goal of reaching about 500 vaccines in the community. Sid did the same in Imperial Beach, which started with about 100, and then now we're doing 300 a day. Coronado as well, Chula Vista, the Oxford Street one, and then National City and Southeast San Diego, the Tubman Chavez Center are still doing testing and COVID. But, I'm really proud that we were able to do this in a really short amount of time. What's really important about these pods is we are building the infrastructure, and we'll talk about this some more because I know people will have questions about this. But I wanted to make sure that I highlight that, we do have a shortage of vaccines, and we'll chat about that in a minute. But I'm really, really proud that we were able to build this infrastructure so that as the vaccines are coming from the federal government, we're able to get them into our communities. And if you see the location of each of these pods, they really are in our communities, right? As people so addressing some of the hardest hit issues, which include transportation barriers, etc. And so I wanted to make sure that I share that slide with you. The next one, please. So I think it was the other one. Oh, that's it. Okay, sorry. I'm extremely proud to serve. I think many of you know I get to serve as COVID-19 co-chair of the board, in addition to being the vice chair of the board, and where the county is really working to address the vaccine disparities, availability, and our efforts to serve our communities of concern. And, I really, I think for the first time, we're really talking about equity, building, really bringing equity to the vaccine distribution portion of it. And so I'm working to make sure that we stop the surge of the COVID-19 cases. That continues to be part of the conversation, because I know a lot of folks are focused on the vaccine, but we have to make sure that COVID cases are reduced in our communities. And so we want to make sure that everybody gets vaccinated. We want to make sure it's quick, efficient, and it's done in an equitable manner, right? I do understand that there's a lot of frustration due to the lack of vaccine supply. I think challenges with securing appointments have been really tough. I know that for our undocumented populations, it continues to be a challenge. And so there's some couple of things that we've been doing. And I want to make sure that people know, I've also been very frustrated, and I understand the concerns. But I really want everyone to know that for the first time, right, you have a public health care expert on the board. And that allows me to challenge and to really bring the experience that I have from 25 years of working in this field to ground the work that we're doing and really challenge some of how we're doing the work. And so I understand that folks have concerns about who is next in terms of getting the vaccines, and I've heard from the community. And I know that it's a very difficult decision to make, but we're following. I hear you loud and clear, but I want to make sure that everyone knows that we're following the CDC guidelines and state guidelines to make sure that we're distributing the vaccines to the most vulnerable populations. And our seniors and our first phase approach has really been the way we have done this. And so I know there are challenges to the system. For example, the San Diego County we just started this joint pilot program with My Term, the state platform for securing appointments, about 2-3 weeks ago. And we knew that the platform had challenges from day one. And so we're working to address some of those challenges around appointments, availability, language barriers, and the technology divide that's extremely real. Similar, I heard, from folks that UCC was asking for people's social security number. And so we immediately changed that. I've heard from the community, and I think most of you know that I'm very accessible on social media. So I get a lot of people messaging me and folks letting me know, right, that it's really tough for them sometimes to do this. And one of the ladies said to us, that she didn't have a way to prove that she lived with her daughter because she was about 70 years old, and her daughter is the one that pays for rent and stuff. And so and she didn't have an ID. And so we ended up changing some of the requirements so that, really emphasizing the need for flexibility, and so that she can use her matricula consular, and then her daughter could show her phone bill so that she could be allowed to get her vaccine. And so it's not the most efficient, but it's, right now I think the county team and everybody that we're working with understands that flexibility and being nimble and is really important as we're trying to really address how we're impacting our communities. And so that said, I do want to highlight, next slide, that 357,000 doses have been administered in San Diego County, and we will be continuing to vaccinate throughout the weekend with a goal of reaching over 500,000 doses by Monday. And we've made a commitment as a county to create an infrastructure, really. I think I got ahead of myself with the slides, but it's fine. We made a commitment as a county to create an infrastructure really to make sure that when the vaccines come, that we're ready to go. And so we're ready, and we're waiting on the federal government, and going to keep advocating and pushing for that so that we can get as many vaccines as possible. On the side of economic recovery, I just want to make it clear that COVID actually, I think all of you know, has not only impacted people's health, but it's also caused an economic hardship for both to our individual families and to our business community. And I think many of you know that SANDAG reported that local unemployment rates have skyrocketed from 3.1% before COVID to 25% in May. An estimated 250,000 San Diegans have been unemployed, and that families that are already struggling to make ends meet are being hit the hardest. And so it's our responsibility to ensure that we level the playing field in our communities and provide resources that are going to help stimulate the economic recovery. So recognizing the impact our business community has had, we've set aside $47.5 million to small businesses, and I know that many of you worked really diligently to make sure that those resources were allocated. 17 million of the economic stimulus program went to small businesses, and we're fighting for additional dollars as we're moving forward. The governor has released his 21-22 budget for the state of California, and in it, the governor provides about $575 million for small businesses relief. And so this program is really going to have some additional dollars for micro, small business, and nonprofits. And so we're going to be working together with all of you to make sure that those resources are provided to our communities. And so I'm really hopeful that under the Biden administration, there's going to be additional money allocated for our relief in our business community, and we're going to fight for that. And while this alone will not completely alleviate the economic hardship caused by the pandemic, I'm committed to working diligently to secure more funding opportunities for further relief and use data to inform and further guide our actions to mitigate our COVID efforts. I really do understand that this pandemic has caused major impacts to our business community, and we all want to make sure that we get back to our routines. So, however, we don't want to jeopardize our most vulnerable populations, and any actions that we do need to be thoroughly made. So I'm going to leverage every connection that I have across the state and across the country to ensure that we're on the path to recovery and bringing additional resources into community. Next slide. Most recently, I had Commissioner Lara Ricardo Lara join us to talk about some of the opportunities around insurance and how we're going to be able to help assist our communities so that they can, the insurance commissioner can help them, and when they have some of the challenges in terms of their how they're working on workers' compensation and other issues like that. I'm going to be working with my former colleague, California's Treasurer Fiona Ma, to share some of the wisdom of how small businesses can work together through this economic pandemic. And more importantly, I'm going to continue to work closely with my colleagues at Southwestern College, which we know their small business center distributed more grants than anyone in the county. And so you have my commitment that economic recovery is one of my priorities, and I'm going to look forward to working with all of you on solutions to mitigate the economic impact on COVID-19 and how that has had in our communities. And so I really want to thank you for joining me today. I'm excited about being able to answer some questions. I will be sharing with you as we move along. Next slide. More information on how we can actually, continue to address some of these issues. But I felt that it was very timely to really chat about COVID, the vaccines, economic recovery, tell you a little bit about me, and we'll continue to do this great work as we move forward. So thank you so much.
Thank you so much, Supervisor Vargas. We really appreciate all of the work that you're doing. You are one busy person. So we do have some questions in the chat, and I would encourage those of you in the audience that have questions. I see one person has their hand raised. Rachel, if you have a question or a comment, if you could put that in the Q&A feature, that would be wonderful. That would help us out. Okay, so the first question is, well, first a comment. Supervisor Vargas, thank you very much for everything that you are doing for our community. I know that you are promoting the website of vaccinationssuperstationsd.com, which is very good, but would it be possible to have a name in Spanish for the Hispanic population? This name seems to be difficult for them to log in.
Yeah, I know. It's not just for the Hispanic population, for everyone. Even when I'm actually talking to reporters, I forget the name, and I don't really understand how this happened. But so yeah, I will go back and ask that question. To be honest with you, we actually recommended that all of these websites would be put into one, because it was like the coronavirus pandemic, there was the vaccines, there was every superstation had their own. So we will go back. I will go back and duly note it and see if there's something that we can do to change that. Thank you.
Thank you. We have another comment. Thank you for highlighting and championing this now. It's extremely important as the number of vaccines increase and our most vulnerable aren't left behind. Max sees these inequalities daily throughout the county, and your leadership on this gives hope. Okay, and then we have...
I love the MAC project. Just so that all of you know, my mom worked for the MAC project for about 17 years, so I'm a Mackie, and I bring the MAC project in my heart wherever I go. And they got a shout out by Chef Marcela Valladolid and Selena Gomez the other day on the HBO Max. If you like to cook, it was on there. So kudos to the MAC project and Arnulfo and everybody else who's doing a great job there.
Okay. The next comment and question is from Dr. Escobedo. Thank you for all you do. I appreciate your work, expertise, and passion for our community. Reviewing the vaccination dashboard, there seems to be a significant difference between those who are being vaccinated by ethnicity and region. How can we help the process for a more equitable distribution?
Yes, that's a fantastic question. And today I'm going to have a panel. So I do this weekly social platform conversation called Conexiones, and it's in English and Spanish, and it started during the campaign to really bring information to our communities and resources. And so I invited community groups and leaders to join me today so that we can continue to address this issue. But the way we've been sharing information around this right now is that as all of you know, there is a clear disparity and inequity in terms of communities of color in the healthcare field, right? And so the first phase demonstrates that very well, because the first phase was really mostly healthcare providers. And so right now, the numbers for most of the communities of color are between 13 and 14% and 7%. I mean, it's pretty real. So it's very reflective of our healthcare community. But now we've transitioned. We have now for a week and a half, almost 2 weeks, have been now in the 65 and older. And so now what we're trying to do is make sure that we really break down some of the barriers that we have within the system, like, it's super hard for people to sign up on the My Turn, right? And so we're creating now new systems so that people can actually sign up, and somebody can help them, get their appointment. So what I will say, and I've had this conversation with Ana Melgoza from San Isidro Health a couple of times, I think this is the time where we're going to have to make sure that we are helping each other, that our neighbors are helping each other. Right now, I think the numbers are 13% for Latinos, 2% for Black, 12% for Asian. And so these numbers really, I think we have a responsibility to work together to change this, and we're going to do everything we can to make that happen. So I wish I had a better answer for that, just to say that we're going to keep at it, and whatever we can do to break down barriers is going to be what we need to do.
Okay. Are volunteers still needed to help support the distribution of the vaccines at the different locations, clinics, et cetera? And if people wanted to volunteer, how would they do that?
Yes, what I'll do is I'll have somebody from my team put it up there, because I don't have the information with me, but there are opportunities for people to volunteer, especially if you are a healthcare expert, like if you're a retired doctor or nurse or an EMT or someone that is able to give the vaccinations. I think that one's really, really important. Not only do we have a challenge with supply, and I think everybody who's in the healthcare industry understands that we are really Our nurses and our doctors are exhausted, and if any of you who are here from the hospitals and the clinics, a big virtual hug to all of you, because we know that you've been working tirelessly through COVID, and nobody got a break, right? They went from COVID directly to vaccination, and there's still a lot of folks who are working directly on COVID, and so I want to make sure that we do what we can to help our communities understand that the more people who can step up and volunteer who are healthcare providers, it would be great.
Okay. Excellent. All right, so here's another question. Thank you for taking my question. I saw an entry on the Nextdoor app that if you go to a COVID-19 towards the end of the day, you can receive a leftover vaccine that was intended for a person who no-showed for their appointment. Is that accurate?
Okay, so we created an actual process so that if people, if they do have extra vaccines, there's a standby list, and it's supposed to go based on phases and years. Sometimes things happen. People have gotten through the system. There's holes in it, but we have protocols, and we're very clear. I know that some of our, we've been able to call some of our first responders to come in and get their vaccines because they're able to just join us at that time. And so that everybody knows, for those of you who have not gotten a vaccine, it's a little, the vial is like this small. There's 5 vaccines that are supposed to be in each of the vials. At times there's 6, depending. Moderna and Pfizer have 2 different ones, and so it just depends on which one it is. And sometimes when they have extras, they have to make sure that they use them within 6 hours so that they don't waste it. And so that's how some people have been able to get the vaccine. The idea and the goal is that if you're, that we need to make sure we're focusing on phase 1, and then we continue with the rest.
Okay. There's just some comments as well in the chat that I thought would be good to highlight. That our partners from, let's see here, the San Ysidro Health Center is here to vaccinate as many Chula Vista residents as possible. So this is from Anna Malgoza. We are working with longtime partner Southwestern College, paramedic EMT nursing students to do evening and weekend vaccination visits for our registered patients.
Yes, I'm so excited. And, I have to just give a shout out to my Southwestern College family. And, Dr. Murillo is retiring, and she's done an exceptional job. And I keep calling her and texting her, and I said, you can't get rid of me even if you want to. But, I nominated our nurses and our EMTs, and they had already been starting to do that work already. And then we have a pot at the San Ysidro Center at Southwestern College, which is another very familiar place for folks. And so I'm excited about that. And now thinking about maybe we can get another one at the college as well. But yeah, so I feel really fortunate to be in this role because, I'm only as good as the people that I work with, and not only my team, but my community and the community that I loved and that I have worked with for 25 years. And so it's really my privilege to be able to pick up the phone and call people that I have worked with on the ground for years and be able to say, hey, what do you think? How do we do this? And any recommendations? And so I am really grateful to so many people who are here on this chat who have extended their recommendations, their help, and they've just been so helpful, because I think right now more than ever we all just have to really work together and get everybody vaccinated, get back to our routines and better.
Yeah. Can you talk a little bit more about the rollout? So for example, this week, the state of California announced that we would be moving into phase 1, 2B that included childcare and educators and others. But the county of San Diego is not there yet. So where can people go to find out the most up-to-date information, and how is that rollout happening?
So I think many of you know we do a Wednesday press conference where we update everyone on where we're at, and so you get to see both Chair Fletcher and myself give updates on Wednesdays at 2:00 or 2:30, I think it is, and we do it live on Facebook, and then we share the information. Things are moving really fast, right? We have COVID meetings, and just so you can think about what the day looks like for me. 8 a.m. COVID meetings, subcommittee COVID meetings, policy subcommittee meetings for COVID. So it's COVID, 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 and vaccines. And then my team works together to try to really think about the outreach piece and how we're getting things done. And so what I want to remind people is we really are in a crisis management mode. This is not like a typical way of doing vaccinations, right? Like your flu vaccination, et cetera, because with flu vaccinations, you have your supply. I've talked to Kaiser, I've talked to Sharp, I've talked to other of the healthcare providers. They get their supply of vaccines. They know that they can get their vaccines out between September and December, and it's going to have an impact. But they're able to manage that. Here, we don't know. Imagine having to distribute something, but you don't know how much you're going to get. So every day, so I was telling somebody, right? So like this week, we have 10,000 vaccines to distribute, and 2 days ago, when I was on a panel, I said to folks, we don't have any vaccines as of Thursday morning. And so, I've never, I've been an executive in as a healthcare provider for 20 years. It's one of the weirdest ways to actually have to manage something, but this is what we have to do. And so what I would say is that press conference on Wednesdays, our office is trying to make sure that people get information as much as they can, and we're going to continue to share what we can. If my office, I think, would be the best way if you have any questions around that. We have to make really tough decisions, right? The federal government, CDC, they have the guidelines, the state has guidelines, but then we have to decide, okay, where are we with our distribution right now in terms of first phase and first responders and 65 and older, and do we have enough vaccines? And then vaccine number 2 has to be given to a lot of people now. Remember, you have to get your second vaccine between 21 and 28 days. And so all of that are factors. And I have to tell you, there are people who are way smarter than me that are doing this work. The healthcare experts who are the doctors, Dr. Wooten, I think if you see her, send her virtual hugs. Dr. McDonald, Nick Maccioni at the Board of Supervisors. I think many of you know Barbara Jimenez. These folks are working night and day. And, I've been on the outside, challenging the county for many, many years. But I'll tell you, being on the inside now and what we're asking them for, they're doing a good job trying to manage a lot of I wouldn't call it a lot of they have to be very nimble, I think, in how we're making the decisions right now and how to move forward. But it's all based on science and data and equity. And I want to make sure I emphasize that, because all of it is being done with that lens as we do this work.
Excellent. Okay. Before we move on to another topic, there is information in the chat if folks are interested in volunteering. Take a look at that. All right. And then I would encourage anyone who has questions to please add them to the Q&A feature at the bottom. Okay. The next question says, I would like to know what the public health crisis emergency declaration for the Tijuana River would allow. The EPA is taking the lead on the mitigation efforts using the SB 507 study prepared by the County of San Diego. Would that allow the county further leverage on the mitigation strategies?
Yes, but in addition to that, I think one of the reasons that we had this conversation is because there is the mandate. I mean, not the mandate. The EPA is fighting, for these resources. They're basically the ones that are sort of holding all of it, and a lot of organizations and groups are part of that and are advocating for it. But it really felt like we needed to come together with nonprofit organizations and other entities to be able to take it to the next level. In addition to that, I think we have a very new administration. We have a new administration at the federal level where we can actually ask for monies from healthcare entities as well. And that hasn't really been done before. It's only been seen as an environmental issue and not as a healthcare crisis. And so I think that if we do it that way, there'll be additional resources in elevating this issue to the next level. I think most of you know that air quality is a huge issue in District 1, particularly in San Isidro, Barrio Logan, the Sherman Heights area. All of those areas have been impacted. And I think, making this a public health care crisis really releases new resources to be allocated and to address this issue for once and for all. And I think what we've seen, and this came about from a conversation at UCSD with some of the folks, and I think Serge Dedina and Paloma, from Councilwoman Paloma from Imperial Beach have been exceptional in sharing information with me as well. the particles that they find now in Imperial Beach on the cars are very concerning. And what they're seeing is like what we see with COVID and how it spreads. You really are seeing, we really are looking at things that we might have not looked at before. And so really what I want to do is elevate this issue to a next level. And it's really important, I think, that we are one voice. And I really want to lead in this committee. And I know no one needs another meeting and nobody needs another committee. But what I really think that we need is to stop the nonsense of the political sort of stuff, silliness that has happened sometimes in South County, where people are fighting against each other or not working together. And we need to get above that and just really push forward as a community and really address this issue and get additional resources to our communities that have been impacted. And it's not just the beaches, it's really the people who are working in those areas, right? Our federal agents. I think everyone saw that 60-minute special where they were talking about flesh-eating bacteria, and it's just unacceptable that that's happening in the fifth largest economy in the world, depending on what day it is. But anyway, so that's what it's going to do. It's going to allow us to elevate it, get additional resources, and we're working with our team to really have a very different conversation about this.
Okay, thank you. Let's see, the next question is, we know that the South Bay has been hit the most with the coronavirus, and the Hispanic and African American populations were the most devastated communities. Are the vaccines distributed in the same proportion as the COVID-19 cases are in the county? Would we be able to receive more in the South Bay?
So I think that's the health equity piece that I was mentioning before. And one of the things that we've done, so the reason why I shared that one slide with all the pods and that the fact that we have 6 in South County is because if you see where the communities of need are, and then where the pods are, and where our testing sites have been. And so what we really wanted to do, and this concept of equity, it's not just a word that we use, right? It's really looking at data and science to identify that. And so what I think the missing piece was that we were opening up the appointments, and anyone can make an appointment whenever the appointment was available, right? And so what we're doing now is we've changed that. And so, and I think it's already changed, but the idea was that if you make an appointment and you live, like I live in Chula Vista, right? I could make an appointment in a 15-mile radius as the first option, so that I wouldn't be going to La Jolla or Del Mar to get an appointment. I would do it here in this area. And so we're trying different things. The system is not as nimble as we would want it to be, right? I think anybody who's been working with EMR, before, with emergency medical records before, knows that those systems are not people friendly. And so I can geek out about EMRs a lot, because we did that at Planned Parenthood when the transition happened from the Affordable Care Act to where we're at now. And so, we really, I think, are trying to figure out what else could we do. And so we are going to, we're launching this Promotora program, and it's really a community health worker program, because people have to have access to, they need to know how to use technology. And so we're going to be able to gather information. Chula Vista has been doing this already with their libraries, where they're actually signing people up. I think they've signed up 300 people already for appointments. I think National City is looking at some other things. And so the county now has opened up, a set of appointments specifically for communities that don't have access to the internet or technology challenges, right? To be able to block designated times for appointments. And so, we're working through it. I think, to be honest, none of these systems, and this is not just, my way of answering this question, but I think, our systems were not created with equity in mind, right? Our healthcare system. And so a lot of it is we have to push and make those changes as we're going on. And it's just not fast enough, but we're going to keep at it, and we're going to get there.
Okay. The next question is, the link between school reopenings and restarting the economy seems clear to many parents. Why not dedicate one day each week to allow teachers who are working with students to be vaccinated? Start with the South County educators. Equity, we are the hardest hit here.
Yeah. So there is next week, I think on Thursday, I'm having a conversation. So let me just step back. On week number 1, on day 4 of my job, I started meeting with all of our mayors and elected officials and local elected officials to try to really begin to address COVID in our communities from that lens. Next week on Thursday, I'm having a meeting with our school board members to begin to have a conversation, and superintendents to have a conversation about what's next. Teachers are next in the tier. There's a lot of conversations about who's been getting. I think there's some folks in Alpine that got the vaccine, but that was related to a tribal area where they actually had extra vaccines, and so they went ahead and gave it to them. There's a pilot program in Coronado that some folks are getting vaccines, and that's a separate project that they're working on. And so I think there's so much information that people are hearing, and I know it's tough, and we are so grateful for our teachers. And I think for all of you who know that I've been in education now for many years, I know how hard you all are working, and my commitment to everyone is making sure, and I did this when I was the president of the governing board for Southwestern College, is that I don't want to jeopardize anyone's lives, right? I mean, I think we made that decision at the college when it first hit with in partnership with Dr. Murillo, and we said we're not going to open up in person because we want to make sure we save people's lives. And here we are a year later, and the college has done really, really well. And I think that as hard as it is, we understand, and I want to make sure that people understand that, we need to get through this, and as soon as we can get vaccines, we'll get back to it. And I want to have the conversation, like I said, with school board members and superintendents next week, because there's a lot of misinformation or different directions coming from the state. But I think in the end, we ultimately will make the decision based on data and science and the impact that it's going to have on our teachers and our community. And I hear a lot from teachers. Teachers were very supportive of me during my journey in the campaign, and many of my friends are teachers, and so I got you. I'm looking out for you because I know how tough it is.
Great. Can you address topics that maybe we haven't covered that affect youth, issues that affect youth? What are some things that you would like to focus on, or that you would encourage community-based organizations like the Y and others to focus on when it comes to youth?
To youth. So, I didn't share this with you just yet, but we are going to be creating a youth commission for the county, for my district. Internships is going to be another project that we're going to be doing, and fellowships. But my big initiative, and I'm still working on rolling it out, which is why I haven't really shared we're in the sausage making process of the initiative, but really an initiative around boys and men of color. Really, it's important for me. I think that, I've been very fortunate to be the product of organizations like Mana de San Diego, right, which is an organization that has really encouraged Latinas and young girls to really, dream for the stars, and they provide resources and tools, and such a wonderful organization. And Hope, right, Hispanas Organized for Political Equality, another great organization that I have been involved with for years, trying to elevate more Latinas and engaged in the political process and civic engagement. And so I really want to look at those models and find opportunities for our young boys and men of color. Unfortunately, and I saw this firsthand at Southwestern College, the pipeline continues to be to incarceration versus education. And for me, it's really important that we find tools. And so the youth component for me is really a priority, and really looking at reducing recidivism and what we're going to do to make sure we target that community. And so we engage that community. The other thing that I want to make sure that you all know, we're going to be launching a literacy initiative. I love to read. I grew up in a family of readers. My aunts were all teachers. My father's a professor. And so we're going to be launching an initiative, a literacy initiative, to make sure that we go back to reading. And I think it's really important if and this is directly connected to education. Having been in higher education now for about 7 years, and being an advocate, one of the things that I realized was that, a lot of our kids, people wonder why does it take 6 years for our students to transfer to four-year universities? And it's not just the system, it's tough to get classes, but it's also the remedial education, right? And there's a better word for that I can't remember right now, but the fact that a lot of our students have to take, English as a second language courses, and they're called something else now. But it took me 3 years to transfer from Southwestern College to the University of San Francisco, and English was not my first language, and I was smart. It had nothing to do with that. It's just the language barrier was a tough one, and so I really want our young kids to make sure that their reading and writing and math skills are strong, and whatever I can do as a supervisor to elevate that and make it fun again, right? And make it accessible, we're going to do that. And so that's a big initiative, and I'll work with all of you at the Y to try to make sure that we're sharing it. And just yesterday, I went to visit a farm here in San Diego. It was super cool. And they have some programs and projects about the environment and how we can build some things into kids. And so lots of ideas and a lot of different things, but I want to make sure we do it right. And I'm spending a lot of time right now on COVID and the vaccination process, but I have a lot of ideas of what we want to do as we move forward as well. So, and if you have any ideas, let me know. We're happy to partner up in anything that you want.
Excellent. Okay, I'm not seeing any other questions. I did want to give my partner Lisa a chance to see. I don't know if you have any questions, Lisa, or comments that you'd like to make.
No, I just want to thank you, Nora, Supervisor Nora Vargas. You did an amazing presentation.
Thank you.
Board of directors and my staff, we're here to partner with you on the economic recovery. Anything we can do to help and assist in that area, we're really happy with our partnership. As for announcements, we have our business mixer starting back next week. It's going to be on the 11th, 5 to 6:30. We'll be partnering with IPS. We'll have council members Jill and council member Andrea talking about Broadway and revitalization. And so we hope you can all join us for a Zoom meeting. We also have our golf tournament coming up on March 29th at the San Diego Country Club. It's a great way. There'll be tee times, not a shotgun start, safe, but also having opportunity to have people get out of their homes and into the fresh air for safety and to thrive again. And then the Game On, we're really proud of our Chula Vistaopoly. We can start selling this again. So we have Chula Vista as a leader in sustainability, and we want to thank our businesses that advertise to promote Chula Vista and a fun game. So when you're home, you can play with your family and really learn about sustainability. Thank you so much, everyone. And thank you again to Laura and to Nora, and look forward to seeing you all next month.
Thank you so much,
Lisa. Everyone. Thank you for having me.
Thank you, Supervisor, for being with us. Our next breakfast is going to be on March 5th, hosted by Mayor Mary Casillas Salas. So thank you all. Have a wonderful month. Thank you, Nora.
Bye. Thank you. Wonderful day. Bye-bye.
Bye.
Thank you, ladies.